mandates and changes. So if everybody can see my blue screen now, we're going to go ahead and get started. So healthcare reform. While the law behind healthcare reform is pretty complex, the main requirement that impacts most U.S. citizens is very straightforward. If you don't currently have health insurance, you need to get it in 2014. The ACA, which is the Affordable Care Act, has actually gone into full effect now, and there is a pay-or-play penalty that starts at 1% of your income, or $95, whichever is greater. Typically, for most of us, the 1% would be the greater. For the 2014 tax year. It's going to go up every year and up to 2.5% of your income by 2016. I'm going to go over, the individual mandate and things like that of that nature to start off with because that affects everyone, and then we'll go into the employer side of it after that. So here's a timeline overview. Most of this has already started. We're already after January 1, but the marketplace opened on October 1st for enrollment. The marketplace, also known as the exchange, which is what most people are used to hearing, opened up October 1 for people to begin enrolling for a January 1st effective date. That marketplace is for people who are looking for help or subsidies or looking at the new plans moving forward. So that started January 1. You can still enroll. The next deadline is tomorrow, January 15th, for a February 1st effective date. And open enrollment ends on March 31st. So once this open enrollment ends, anyone who has not enrolled into a plan can only enroll in Louisiana Co-op, which is a new player out there on the market because they will accept applications all year long, or you cannot enroll into a medical plan unless you have a qualifying event. For those of you who have had employer coverage in the past, you know that a qualifying event would be a birth, a death, marriage, divorce, things of that nature. Other than that, you have to wait until the next open enrollment period to apply for medical insurance. So again, the marketplace. The marketplace, you may have also heard it called an exchange. This is sort of what it looks like here. It is basically a shopping site for health insurance. A lot of people are used to seeing, your Progressives and things like that for your auto and your home. It's basically the same type of thing, except now you're looking at your health insurance. And while the website is healthcare.gov and it's facilitated by the government, you're not actually getting your insurance from the government. The biggest misconception we've come across is people saying, well, I don't want to get my insurance from the government. I don't want to go through them. You're still getting your insurance from your same players that you're used to, you Blue Cross and Humana if you're in Jefferson Parish in Louisiana. In Mississippi, Humana is on the exchange as well. Depending on where you live, you're going to see different carriers, but you're still going to see your health insurance carriers. You're not actually getting your insurance from the government. So each state had the option to set up their own exchange or use the federal exchange. Both Louisiana and Mississippi both chose to go with the federal exchange and let the government go ahead and deal with all that mess of setting up a website. So the insurance carriers, like I said, have the option of selling on there. Some are on there and some are not. The biggest thing for people to understand is moving forward that you do not have to go through the exchange unless you want help with paying for your premiums. You still are able to go through an agent as well. I'm able to help facilitate enrollment on the exchange or off the exchange. So plans on the marketplace. Now you've seen what the marketplace looks like, but how are the plans categorized? There are different plan tiers that are categorized by actuarial value. Actuarial value just means how much that plan will cover. So we have plans starting at the bronze plan, which covers 58 to 62% of your medical costs. What this means is this plan, of course, is going to be less expensive because it covers less, but you have more out of pocket. If you move on to the silver plan, it's 68 to 70% is covered by the insurance company, and of course that plan gets a little more expensive, and then of course we go to gold and platinum. Your platinum plan are more expensive, but they cover 88 to 92%. This means that you have less of a deductible, you have lower co-payments, you have less co-payments for getting your prescriptions, things of that nature. They also have what are called catastrophic plans. Catastrophic plans are lower cost plans with limited benefits. They're not as good of plans. They're what you would typically think of as a catastrophic. It's a just in case something were to happen type of plan. It is less expensive, but only people under 30 or can demonstrate a financial hardship qualify for these types of plans. Most people that are looking to get health insurance have chosen the silver plan or above because they really want a plan that's comprehensive but not costing them a whole lot out of pocket. So an overview of the 2014 premium impacts. So what we've seen because of healthcare reform, your younger, healthier customers who used to pay less, used to pay the least expensive premium because they were healthy, they were younger, they had less things going on for them, paid less. Well, now moving forward, they pay a little more than they're used to. While your older, sicker customers possibly pay less because, one, there's no underwriting, so of course it doesn't matter what type of health you're in, you get the same premium either way. And for two, part of the ACA was that a younger person and an older person cannot have as big of a variation in their premium as they were used to. That older person's premium can only be 3 times higher than that younger person's, which is why the younger people are seeing their premiums go up. The premiums have gone up to kind of compensate. So there are some plans that have what is called a grandfathered status. This means that their plan was in effect before healthcare reform started. This means that they kept their exact plan the way it was, and they have the option of keeping that moving forward. These grandfathered plans, of course, don't have some of the certain things that ACA applies to the new plans. So the ACA plans has had higher rates, but components such as subsidies and grandfathering are kind of helping with that impact. So subsidies will help offset some or all of the costs for some of those who qualify. So a premium assistance subsidy. It reduces the amount that an individual or family pays for health insurance coverage by providing a tax credit. These subsidies are only available through the exchange. So like I said, if you have a plan that you would like to enroll in but it's not on the exchange, then you would not qualify for that subsidy to help with the cost. And they are determined on a sliding scale based on your income. So your individuals with a lower income on the income scale get the most help, and people with higher incomes get the least amount of help. Subsidy is also based on the premium for a benchmark plan. So that would be they base it off of the silver plan, but you are allowed to apply it to any plan. So if you qualify for subsidy, but you say, you know, I really like this platinum plan, then you're just going to pay the difference. So what you see now is the annual income federal poverty level chart. What this shows is anyone who is from 133% up to 400% of that poverty level will qualify for a subsidy. If you look at the 400% for a 4-person family, you can make an income of all the way up to $94,200 a year and still qualify for some sort of assistance. Now, the reason I'm saying from the 133% on is because anyone below that actually qualifies for Medicaid. Now, Louisiana and Mississippi did not expand their Medicaid. What the government was trying to do was expand Medicaid to all adults who have lower income. Each state had the choice to choose whether or not they were going to expand Medicaid. Louisiana and Mississippi chose not to. So what we're seeing is there's this donut hole, this gap, where people who have really low incomes and would normally qualify for that Medicaid program do not, and the federal government still is not noticing that they're in that gap, so they're not covering them for a subsidy. So we do have a lot of low-income people that we're applying right now and finding out that they, you know, of course they have the lowest income, so you would think they would get the most help, and they're not getting any help right now. The government has stated that they are going to try and fix that on the system, but it hasn't happened as of yet. So moving on from the individual side over to the employer side of it. So with the Essential Healthcare Reform ACA Compliance Checklist, the first thing you want to do is decide how many employees do I have. Not how many employees do you have that you would typically think of, but how many do you have in the eyes of the government. So the first step would be to go ahead and count up how many employees you have full-time, then count up all of your part-time people. 2 part-time people, if they make 30 hours together in a week, you now have one more full-time person. This is something that CPAs can be very helpful with in keeping track of to make sure they know how many employees you have in the eyes of the law. The reason I say 30 hours is because typically, you know, we've always determined an employee as being full-time based on what we decided in our company. Some companies said 30 hours, some said 32, some said 40. That was a full-time employee. In the eyes of the law, when it comes to benefit purposes moving forward, any employee making 30 hours or more is considered a full-time employee. And if you offer benefits, you should be offering those to them. So you're going to look at your 30 or more per hour employees, figure out how many of them you have, look at your part-time employees, figure out how many of them you have, and once you put them all together, if you equal 50 or more, you by law must offer insurance for your employees. If you have less than 50, you do not legally have to offer insurance to your employees. So once we decide if we have 50 or more full-time employees, let's say we do, and we need to offer insurance, the next step is to make sure your current benefit plan meets the minimum actuarial value. As I said before, we have to look at the actuarial value as how much does that plan cover. And this is something that your agent or your insurance carrier can help you decide. So if your plan covers 60% or more, you've reached that actuarial value, and you do not have to worry. You cover what you're supposed to cover. The next step, once you determine all of this, is to look at your employee contributions. Your employee contributions cannot exceed 9.5% of that employee's salary. The safe harbor tool that we're using right now is looking at that W-2 for your lowest paid employee, looking at box 1, and making sure that whatever they contribute for themselves on their plan does not exceed 9.5% of their annual income. Now, the reason we say it's a safe harbor option is you do not know what that employee's spouse makes. You do not know what their family household income is. You only have to worry about what you pay them and that it doesn't exceed that 9.5%. You also don't have to worry about the cost if they're covering their children or their spouse on that plan. You just have to make sure what they have to pay for themselves, that one employee, does not exceed that 9.5%. The next thing you'll see is a notice of marketplaces. Many of you may have already handed this out. This is something we do kind of as a value-added service for our clients, is each employer should have already passed this out to their employees. All this does is it just states what options are out there, that the marketplace is now open, and tells your employees where to go. If you do offer a plan to them, you do need to fill in your plan options, let them know what's covered. If you don't, you just fill out the sheet that says nothing's covered, you don't offer insurance. What we had done was go ahead and draw up a simple letter to go along with those letters to the employees, because a lot of the time the employees don't understand exactly what's being written there, especially since it's something that was typed up by the government and sent out. Sometimes it can be a little convoluted. What we did was go ahead and type a letter. It says, "Been federally mandated beginning January 1, every individual will be covered by health insurance." This is to make sure that people know that everyone has to be covered. Your spouse, your dependents, everyone must be covered. Also letting them know that they have the option to look on the marketplace, and if they don't go on the marketplace or they don't get insurance individually or through their company, that there will be a penalty. So penalties for employers. So simply offering coverage doesn't eliminate exposure to the penalties. Like I said, you have those benchmarks you have to also make sure are being met. So let's say on the right-hand side you're looking at no coverage offered. I have 50 or more employees and I've decided to just not offer insurance. These penalties have been pushed back, so starting in 2015 is when they really need to be worried about. As of right now in 2014, employers are okay. So the law is still there stating that you have to offer the coverage. There's just no penalty right now. Starting next year, there will be. So if you decide not offer coverage, the annual penalty is $2,000 per full-time employee. Remember, that's 30 plus, and it excludes the first 30 employees. So if you have 50 employees, it excludes your first 30, and you pay $2,000 for the other 20. That penalty, of course, is also going to increase each year. And this penalty also applies if at least one employee purchases subsidized coverage. So let's look over on the left-hand side. Let's say that employee, you have an employee who decides to go on the marketplace and receives a subsidy. They have coverage through you. That coverage is being offered. They just chose not to do it. That penalty then goes up to $3,000 per full-time employee. And again, that's 30 plus hours a week. So the penalty, of course, again, increases each year. And the penalty also applies if that employee's coverage isn't affordable. You may offer coverage, but it's not affordable to them, or it does not meet that minimum value, then you are still going to be penalized at $3,000 per full-time employee after the first 30. This next thing is it's just a helpful reform website, and I believe Natalie said she's going to record this and send it out to everyone. But healthcare.gov, that is the site for the exchange. It also has a lot of helpful information if you have any questions. The Center for Consumer Information and Insurance Oversight. This is actually being overseen by Medicare and Medicaid, and it's part of DHS. And these are the people that are helping facilitate everything behind the scenes. The Department of Labor, of course, everyone that has employees, that's a very helpful website to go to. And KSF.org, Henry J. Kaiser Family Foundation. This is a very helpful website when it comes to learning more about health care reform. There's actually a subsidy calculator on there. So if you decide, I want to know what my subsidy might possibly be, but I don't want to actually apply right now. There is a calculator on there that is very accurate, I've seen after calculating and then applying people. That will help you determine kind of where you'll fall. This is just my certificate of completion. I am healthcare reform certified. So is Ray Guzman, who is the owner of our company. This is why we're able to put things like this on. We've put a lot of time into learning about healthcare reform and making sure that we can advise everyone very well. If you ever need to contact us, that's our contact information. And I guess we'll go ahead and open it up for questions now. Does anybody have any questions for me today?
Anybody have any questions? You can either unmute yourself. Right now I have everyone unmuted. Of course, you may be muted on your own side. Or if you feel more comfortable, you can type in the chat section to ask any questions that Crystal might be able to answer.
Also, if you have anything that's more specific to your company that you would like to sit down and talk about, Natalie has our contact information as well, because a lot of the time the questions that people have are very specific to their company and the way their companies are set up. So if you ever need to talk, we can go ahead and set that up as well. All right, Nat, I guess we don't have any questions today.
All right, here we go. Here's one. They wanted to know if they could have a copy of the presentation that you've gone through today.
Sure, I can actually, I know she's going to email out the recorded version, but I can also go ahead and put in a PDF and I can email it out as well.
Perfect. Thanks, Crystal. Anyone else? Anybody have any other questions? All right, you guys. Well, I'll make sure, like I said, to get this out to you guys hopefully by the end of the business day today. So you should have the recorded version as well as the PDF of the PowerPoint. Crystal's information will be included in that email to you, so if you have any questions that you'd like to contact her personally on, you'll be able to do so. But thank you so much for joining us today. Crystal, thank you so much for your time and going over the information with us, and we'll be in touch with everyone soon.
All right, thank you.